Welcome to Anatomy DAHAR series. Today's topic is blood supply of the tongue. Illustrated and presented by Dr. Abdul Hamid, Abdul Rashid. Blood supply of the tongue. The tongue, one of the most mobile structures in the body, is entirely made up of striated muscles and rich in blood supply. Each half of the tongue has corresponding sets of arterial supply and venous drainage. Arterial supply of the tongue. Each half of the tongue received arterial supply from number 1, lingual artery, and number 2, ascending pharyngeal artery from the external carotid artery, number 3, tonsillar artery, and number 4, ascending palatine artery from the facial artery, and number 5, epiglottic branches from the superior laryngeal artery to the valvular part. Arteries of the tongue. We have already listed out arteries of the tongue in the previous slides. Now I'm going to show you in this diagram. This is common carotid artery. This is internal carotid artery. ECA is external carotid artery. FA is facial artery. SLA is superior laryngeal artery. Now, what are the arteries of the tongue? Number 1, lingual artery. Number 2, ascending pharyngeal artery. They are branches from the external carotid artery. Number 3, tonsillar artery. And number 4, ascending palatine arteries are branches from the facial artery. Number 5, epiglottic branches are from the superior laryngeal artery. A rich arterial anastomotic network supplies the musculature and dense submucosal plexus of the mucosa of the tongue. The first artery is the lingual artery. Let's see the diagram first. This is external carotid artery. This is hyoid bone. This is the body of the hyoid. This is greater horns of the hyoid. And this is hyoglossus muscles, which is partly open so that we can see the structures going deep to it. The lingual artery is the chief artery of the tongue. This is the lingual artery. It arises from the anterior aspect of the external carotid artery, opposite to the tip of the greater horn of the hyoid bone. It is tortuous and stretchable for the flexible movements of the tongue. This artery is tortuous and flexible for the movements of the tongue. It passes forwards deep to the hyoglossus muscle, which divides the lingual artery into 3 parts. First part, second part, and the third part. This is the first part, which is proximal to the hyoglossus muscles, that is between the origin from the external carotid artery to the posterior border of the hyoglossus muscles. It is located in the carotid triangle. It forms a characteristic upward loop that is laterally crossed by hypoglossal nerve, that is the 12th cranial nerve. The first part of the lingual artery gives a branch called suprahyoid branch, which is above the hyoid bone and supply the root of the tongue. The lingual artery continuation. The second part of the lingual artery. It is deep to the hypoglossus muscles. You can see here, this is the hypoglossus muscle. When you open it, deep to the muscles is the second part of the lingual artery. This part gives 2 to 3 dorsal lingual branches to the posterior part of the tongue. These branches are also deep to the hypoglossus muscle. After the second part, this is the third part. The third part of the lingual artery is distal to the hypoglossus muscle and is known as deep lingual or profunda linguae artery. It ascends along the anterior border of the hypoglossus muscle and passes forward to tip of the tongue. At the anterior border of the hypoglossus muscle, the lingual artery gives a branch called sublingual branch to the sublingual salivary glands, SLG, and floor of the mouth. This is the coronal section of the tongue. These are the extrinsic muscles. This is a pair of genioglossus muscle. This is a pair of styloglossus muscle. These are the intrinsic muscle of the tongue, superior longitudinal muscle. This is median septum of the tongue, which divides the tongue into right and left half. Median septum of the tongue prevents the communication between the dorsal lingual branches from the second part of the lingual artery of two sides. So, dorsal lingual branches from the second part of the lingual artery of two sides cannot be communicated because of prevented by the median septum. However, deep lingual arteries from the third part of the lingual artery communicates with the branches from the opposite side, near the tip of the tongue. So these are the deep lingual artery from the third part, which can communicate between the two sides, near the tip of the tongue. The first part of the lingual artery is the preferred site for applying ligature. Venous drainage of the tongue. Venous drainage of the tongue mainly follows the arterial pattern of the tongue. It has two routes. Anteriorly, the venous return from the tip of the tongue is by deep lingual vein. Deep lingual veins. This is a diagram of open mouth showing the inferior surface of the tongue. This is tip of the tongue. This is root of the tongue. This is floor of the mouth. This is median mucosal fold called frenulum linguae. It is attached between the undersurface of the tongue and floor of the mouth. These are a pair of deep lingual veins which are located on the undersurface of the tongue, running backwards, visible along each side of the frenulum linguae. They are the largest and principal veins of the tongue. Sublingual absorption of drugs. For quick absorption of a drug, such as nitroglycerin, as a vasodilator in angina pectoris, the pill or spray is put under the tongue where it is dissolved and absorbed through the deep lingual veins in less than 1 minute. Deep lingual vein continuation. This is the deep lingual vein, begins from the tip of the tongue, runs backwards along the lower surface of the tongue. We have already mentioned in the previous slides. Once it reaches to the anterior margins of the hypoglossal muscle, it descends along the anterior margins of the muscle until it reaches to the bottom. Here it receives another vein called sublingual vein, which comes from the sublingual salivary glands and floor of the mouth. These two veins join together and form single vena committance of the hypoglossal nerve. Single vena committance of the hypoglossal nerve runs backwards and has a variable ending. It may join with the lingual vein, facial vein, or internal jugular vein. This is the deep lingual vein coming from the inferior surface of the tongue. This is hypoglossal muscle. Deep to the hypoglossal muscles is dorsal lingual veins. They drain the dorsum of the tongue and side of the tongue. Together with two venae committantes of the deep lingual artery, these dorsal lingual veins join and form the lingual veins. Together with the second part of the lingual artery, they lie deep to the hypoglossal muscle. Posteriorly, near the tip of the greater horn of the hyoid bone, the lingual vein commonly opens into the internal jugular vein or facial vein. The end, illustrated and presented by Dr. Abdul Hamid, Abdul Rashid. Now is a good time to subscribe to our Anatomy DAHAR series channel. You will be notified as soon as our next video is available to you. Anatomy DAHAR series also provides other videos related to the present topic. Enjoy and thanks for watching.